Your period is late, but are you really pregnant? What are some of the common symptoms most women experience within that first month of pregnancy? I'm Sunny Gold with the New Mommy Media Network. We'll answer that question and more right after the break. Hi, everyone. I'm Sunny Gold with the New Mommy Media Network, and we're partnering with Pregnancy Magazine to answer the question, how do I know if I'm pregnant? A lot of you may have questions about this. Perhaps you have some symptoms that you have some questions about, right? So we're going to talk about that today. Our expert today is Dr. Anthony Lissy. He's a family practice physician with Diamond Physicians, and they focus on proactive rather than reactive medicine. So, Dr. Lissy, thanks so much for being with us today.
Thanks for having me, Sunny. I'm excited to be a part of this.
So a lot of women may be waiting for a missed period. That seems to be kind of the big sign. Would you agree?
Yeah, absolutely. I mean, over 90% of pregnancies are diagnosed by, hey, I'm late, it's time to take a test. But we have to be careful because some women are not very regular. Their periods may not come every 28 days. And so if they're every 6 weeks or if they skip a month here or there, sometimes they don't know based on a missed period alone.
Well, and also there's implantation bleeding a little bit too. So you could have kind of a false, I don't know if it's a full period, but maybe you can shed some light on that as well.
Absolutely. So implantation bleeding is the phenomenon that occurs as the fertilized egg actually implants into the uterine wall. That act of implantation and adhering to that uterine wall will cause a little bit of bleeding as the vasculature is disrupted in that localized area. That bleeding can be misinterpreted as spotting. Oh, hey, there's my period. I started. I guess I'm not pregnant after all. Well, that's certainly not the case. So we really need to make sure we're looking for other signs or symptoms early on that may let us know that pregnancy is here.
All right, so let's dive into some of those other pregnancy symptoms. What are the common ones?
Yeah, the most common ones are, a little bit of increased in moodiness, that kind of feeling like you're right about to start your period. Well, that's a lot of times due to the hormones in pregnancy that are spiking and going out of control that are causing you to feel a little bit off and maybe a little bit more irritable. Certainly the most common ones are shortness of breath and fatigue. Hey, why am I climbing the stairs and all of a sudden getting winded? This isn't normal for me. That's a good sign that your body is under increased metabolic demand. We may be thinking pregnancy at that point. The most common ones, sore breasts. As the hormones change, females' breasts will become more sore and you'll have increased tenderness there. That's a great sign that pregnancy is here. In addition, we're going to have nausea around 6 weeks. So that's that early hyperemesis gravidarium that can occur, the morning sickness. That's a good sign. Hey, something may be going on. Finally, you're going to have headaches. You're going to have body aches sometimes. You're going to have increased cramps. All these things are present and can certainly indicate that you're pregnant. So it's about time to get checked out.
Yeah, so definitely signs to look for, but really the only way to confirm a pregnancy, we can't just go based on our symptoms, right? We need to take a test.
Absolutely. The over-the-counter urine pregnancy test, surprisingly accurate. It's just as accurate as the ones I do here in my office. So if you take one, it's fairly easy to interpret now. They've really done a good job in making it kind of foolproof. You don't have to interpret pluses or negative or one line or two lines. There's a lot of them now that are digital that just say positive or pregnant. And so easily we know that something may be there. Now, if you get a positive pregnancy test on the urine, it's time to go ahead and call the doctor who you plan on having a relationship with for the next 9 months to be able to handle the pregnancy and deliver the baby. Because what we like to do is around 8 weeks or so, we like to get an ultrasound of the uterus to make sure that this pregnancy is an intrauterine pregnancy, meaning that fetus developed into the uterus and implanted into the uterine wall rather than the fallopian tubes, which could be an ectopic pregnancy, which is actually a surgical emergency and can certainly harm mom or baby. So back in med school, they always taught us two things with females. Number one, every female is pregnant until proven otherwise, and every pregnancy is ectopic until proven otherwise. So doctors are very careful to make sure we're testing and make sure we're knowing that this is an intrauterine pregnancy that's going to be very safe. Not to mention, we may find two in there. So it's always good to look. We always can do blood tests as well to confirm the diagnosis, as well as track the HCG levels. That's the hormone that can change during early pregnancy. We want to see that double about every 24 hours, and so then we'll be able to monitor whether this is a safe pregnancy and that things are developing the way they should. In certain cases, that's not necessary for all, but you may notice that your doctor may want to do that if they find one or two specific factors that you're dealing with that may make you more predisposed to issues early on, or if they see things on ultrasound that may be worrisome to them.
I know for a lot of moms, those pregnancy symptoms, the early ones, can seem kind of frustrating. There's a lot going on with your body, but I also remember between getting that positive pregnancy test and sometimes it's up to a month, 4 weeks or so before you get that first appointment. So the positive side to all of those symptoms is usually if you keep experiencing all that, your baby's still growing and things are still on the up and up, at least until you can get in and see a doctor.
That's a great point. Yep, a lot of women really worry about that early on and fret over not being able to get in time. But just know, more than likely, everything is going nicely as long as you're having those symptoms. And then once you get in to see them, you'll know.
Absolutely. All right. Well, Dr. Lissy, thanks so much for being with us today. If you like this video, please check out all of the videos that we have in our library. You can do so at newmommymedia.com/pregnancy magazine. It's also where you can download our free apps. You can check out our newsletters and learn all about us and all the various ways we can help you out throughout your pregnancy.